Hi everyone, welcome back. Today we're going to be talking about specific contouring that we can do to enhance beauty. So the topic of today is fox eye lift, so lifting the lateral canthus of the eye, the side of the eye, to give that nice kind of aesthetic result. And we're going to do it with filler. So we're going to talk about how to enhance this whole eye area with specific dermal fillers injections. So Dr. Solomon, what do you do when you look at this area, and what do you look to enhance?
So a lot of people often come in and complain about volume loss in the area. The area of concern here is the lateral aspects of the eyes, or the lateral canthus. We term it the palpebral groove, so it is a natural anatomical feature. With time, starting in our 20s, so we do start aging in our 20s, unfortunately, we lose fat volume in the area. And when you lose that fat, the skin sinks in, you get this groove, and that is the palpebral groove. The groove is more prominent, the groove is always there, but it's filled in with fat. So I often say to patients, think of a down jacket with down feather in it, and that down feather has been lost or has shrunk in volume. So you see a lot more sinking of the canvas of the jacket. And in this case, the canvas of the skin is sinking into that groove. So by revolumizing it, not only are you replacing that volume and sort of restoring youth, you're also lifting the area.
So as we can see, everyone does sort of tear trough injections. So looking at from the medial canthus to where this mid-pupillary line sits, that groove that you see there, that's called the tear trough. So this area is the tear trough. What Dr. Solomon was referring is this palpebral groove, which is this side area that supports the side of the eye. So you can see in this patient, you can see that there's some hollowness just sitting in these specific points, so deep to this area. If we fill this area, you'll get this little bit of lift that sits there. Now, we're going to do some separate videos looking at my reverse C and C shape, just to kind of lift the brow and give a more of an aesthetic look. But today we're just talking about very small specific injections just for that fox eye. And that's what people talk about. When you're doing that makeup in the eyeliner and you're flicking it up, that's what you want. So with a few injections of dermal filler around this region, you can achieve that look. So this is the Restylane Eye Light Filler. It's a specific product for the tear trough, so it's approved for the tear trough. But better than other products, it's a lot more precise. So it's designed to be injected deep on bone in boluses such as this. So when Dr. Solomon was talking about that down jacket, you want to create this structure that all the tissues can sit on. So rather than putting a lot of filler in there, you can put these 3 small boluses that will scaffold and lift that area. So you get away with using less product around the eye area, which is better for long-term swelling. And also it means that you got a more natural look rather than looking puffy. So it's building blocks, and you can build on that over time. So you can create your own tower if you want to. Okay, so little small injections. Just remember, we're going deep on bone. There is a technique that if you look at my educational series where I use a cannula within this region, but for Chloe I want to make sure that I'm deep on this bone, so the lateral orbital rim. So just note, look, we've filled this area, as you can see. Now you can see the actual hollowness that she has emanating just in this area. So we know that our second bolus is going to sit just about here on bone. So we know we're on bone now, which is fantastic. Just note, I'm always aspirating just to make sure that I'm not in a blood vessel within this area, which is really important because obviously safety to avoid an intravascular injection, so an injection within a blood vessel, is super important. So we're starting to see nice resolution. We've got one more injection just in this area just to help. So we're coming within this area, we want to go deep down just on bone. And it's really important to make sure that the skin overlying that area is truly underneath the needle within this region. So it's worth it just to take that time to make sure that you're in the right position. And this uppermost one is the one that supports the side of the eye. So now look forward for us. You can now see that there's no depression within the area. So we can see in this AP view, you can see our 3 small needle marks within the area, but it's improved the hollowness of the side of the eye. You can see in comparison that this whole area looks a lot more lifted. than it does in this area. And that's just an immediate effect that you get with filler. It will settle down, but this is the kind of fox eye look that you can do with simple 3-point injection within the palpebral malar groove. It's something that's really easy to see. So simple things apply, just don't do any exercise for like kind of 24, 48 hours, no extreme heat or cold as well, so no gym, steam room, sauna for 48 hours I normally say. Don't manipulate the area. Note that it can swell a little bit over a period of times, but then just wait a good 2-3 weeks for everything to settle down.